In 1943, while America told the world it was fighting for freedom, the U.S. government was using its own soldiers as human guinea pigs. Black airmen. Heroes who volunteered to fight Nazis, injected with diseases, denied treatment, watched as they suffered. For 40 years, they kept this buried. What you're about to hear will make you question everything you thought you knew about World War II. This is the story they never wanted you to know. Tuskegee, Alabama. 1932. The Great Depression has America on its knees. But in this small southern town, something darker is beginning, something that would haunt the nation for generations. The U.S. Public Health Service approaches 600 black sharecroppers with an offer: free medical care, hot meals, burial insurance. All they had to do was participate in a health study. These men, poor, uneducated, desperate, signed up immediately. They were told they were being treated for bad blood, a vague term that could mean anything. But here's what they weren't told. They had syphilis, and the government had no intention of curing them. The doctors wanted to study what happens when syphilis goes untreated. They wanted to watch these men deteriorate, suffer, die, all in the name of science. This wasn't medicine. This was a human experiment, and it was just beginning. Dr. Talia Farrow Clark, a senior public health service officer, designed the study with a chilling premise. He wanted to observe the natural progression of untreated syphilis from infection to death. He wanted to document every stage, every symptom, every organ failure. He wanted to cut open their bodies after they died and see what the disease had done. The men were never told they had syphilis. They were told they had bad blood, and that the government was doing them a favor by studying them. They were given free meals on examination days. They were given certificates of appreciation. They were made to feel special, important, like they were contributing to something meaningful. In reality, they were being poisoned from the inside, while doctors took notes. And then, World War II changed everything. December 7th, 1941. Pearl Harbor. America enters the war. Suddenly, the nation needs soldiers, pilots, heroes. And despite decades of segregation, despite being treated as second-class citizens, black men across America line up to serve. They want to prove themselves. They want to fight for their country, even if their country hasn't always fought for them. Among them are men from Tuskegee, men who dream of becoming pilots, of soaring above the racism, above the hatred, above everything that's held them down. But there's a problem. The U.S. military doesn't believe black men can fly combat aircraft. They think they lack the intelligence, the coordination, the courage. So in 1941, under pressure from civil rights groups and Eleanor Roosevelt herself, the military reluctantly agrees to an experiment: the Tuskegee Airmen program. They'll train black pilots, but many in command expect them to fail. They want them to fail. What nobody knows is that some of these men walking through the gates of Tuskegee Army Airfield are already part of another experiment. A darker one, a secret one. Charles Dryden, Lemuel Custis, Mac Ross, George Spanky Roberts. These names would become legendary in military history. They were among the first black military pilots in U.S. history. They trained harder than anyone else because they had to. They flew with distinction. They protected American bombers over Europe with a ferocity that earned them the nickname Red Tails because of their distinctive red-painted aircraft. Their record was unprecedented. The 332nd Fighter Group flew over 15,000 sorties. They engaged enemy aircraft 179 times and destroyed 112 enemy planes. More impressively, they never lost a single bomber they were escorting to enemy fighters. Not one. A record unmatched by any other fighter group in the war. But some of them were dying from the inside. Not from German bullets, not from crash landings, from a disease the government knew they had. A disease the government refused to treat. Here's how it worked. When men from Macon County, Alabama, the heart of the Tuskegee study area, enlisted for military service, they went through medical screenings. Standard procedure. The doctors found syphilis in some of them. In any normal circumstance, these men would be disqualified from service or immediately treated, but the Public Health Service had other plans. They saw an opportunity. These men were young, strong, about to undergo the most intense physical training the military could offer. What would happen to untreated syphilis in bodies under extreme stress? How would the disease progress in men pushed to their absolute limits? In men flying at high altitudes? In men experiencing the physical trauma of combat? This was data they couldn't get from sharecroppers. This was a chance to study the disease in young, athletic men under conditions that had never been documented before. The Public Health Service contacted military physicians. They made arrangements, secret arrangements. These men would be allowed to serve, but they would not be treated. Instead, they would be monitored, observed, studied. Their medical files were flagged with special codes that told doctors, "Do not treat this patient's syphilis. He is part of a study." And the men themselves? They had no idea. When they felt sick, when their bodies began to fail them in ways they couldn't understand, they were told it was stress, fatigue, the demands of training. They were given placebos, aspirin, vitamins, iron supplements, anything except the penicillin that could cure them. By 1943, penicillin had been proven as an effective cure for syphilis. It was widely available. The military was using it to treat white soldiers who contracted the disease. Thousands of them. But the Tuskegee subjects, both the original sharecroppers and now some of the airmen, were deliberately denied this treatment. Why? Because treating them would end the study. And the study, in the minds of these doctors, was more important than the lives of black men. Let that sink in for a moment. While these men were flying combat missions over Italy, over Germany, over occupied France, putting their lives on the line for America, American doctors were watching them die from a curable disease. On purpose. They were documenting their symptoms, writing research papers, advancing their careers, all while men who trusted them were suffering. Captain Robert Pitts was one of them. Born in Macon County in 1917, he was a brilliant pilot, a natural leader. He had that rare combination of skill and instinct that made him exceptional in the cockpit. He joined the Tuskegee program in 1942, earned his wings in 1943, and was immediately shipped to Italy to join the 100th Fighter Squadron. He flew 80 combat missions with the 332nd Fighter Group. 8 times he climbed into a P-51 Mustang and flew into enemy territory. He dodged German anti-aircraft fire that could tear his plane apart. He outmaneuvered Luftwaffe fighters flown by some of Germany's most experienced pilots. He protected American bombers, saved American lives, earned the Distinguished Flying Cross. But by 1947, 2 years after the war ended, he was experiencing strange symptoms: blurred vision, difficulty walking, memory problems, confusion. Sometimes he'd forget where he was or why he'd entered a room. His wife, Margaret, begged him to see a doctor. He went to the VA hospital in Tuskegee. They ran tests. extensive tests, and they found what they already knew was there: advanced syphilis. The disease had progressed to neurosyphilis. It was attacking his brain, his spinal cord, his nervous system. But here's the thing: his medical records, the ones the doctors pulled out when he arrived, showed he'd been diagnosed in 1942, before he ever got in a cockpit, before his first training flight, before his first combat mission. The government had known for 5 years. They'd watched the disease progress through primary syphilis, secondary syphilis, and now into the lethal tertiary stage. They'd documented every symptom, every decline, and they'd told him nothing. Robert was 30 years old, a war hero, a husband, a father to 2 young children, and he was dying because his government had decided his life was worth less than research data. He demanded treatment. He raged at the doctors. How could they let this happen? How could they watch him fly into combat while knowing he was sick? The doctors reluctantly agreed to start penicillin treatments, but the damage was done. The syphilis had attacked his brain. It had caused lesions, destroyed tissue, created irreversible damage. He would never fly again. He would never work again. Over the next 9 years, he deteriorated rapidly. The man who'd flown circles around German pilots couldn't walk in a straight line. The man who'd navigated by the stars couldn't remember his children's names. He went blind. He had seizures. He lost control of his bodily functions. Margaret watched the man she loved disappear piece by piece. She tried to care for him at home, but eventually, he needed round-the-clock medical care. He was institutionalized. And in 1956, Captain Robert Pitts, Distinguished Flying Cross recipient, Defender of Freedom, died alone in a hospital bed. He was 39 years old. He wasn't alone. Dozens of Tuskegee Airmen were part of this nightmare. Lieutenant James Walker, who flew 50 combat missions and earned 2 air medals, began experiencing tremors and personality changes in 1948. By 1952, he was institutionalized with neurosyphilis. He died in 1959, never understanding why this had happened to him. Captain Samuel Jefferson, who shot down 2 German fighters over Austria, started going blind in 1949. The VA doctors knew why. His medical file, marked with special codes, showed he'd been diagnosed with syphilis in 1942 and deliberately left untreated. By 1955, he was completely blind. He died in 1961, never having seen his grandchildren. Some died during the war. Their deaths were attributed to training accidents or combat stress. Lieutenant Marcus Williams crashed during a training exercise in 1944. The official report said pilot error. But his autopsy, buried in classified files, showed advanced syphilis had caused a seizure at altitude. He lost control of his aircraft and died on impact. He was 24 years old. And their families? They were told nothing. When these men came home as heroes, with medals and commendations, their wives and children had no idea they were infected. The disease spread silently through households. Wives contracted syphilis from their husbands. They suffered in confusion, too ashamed to tell anyone, not understanding what was happening to their bodies. Babies were born with congenital syphilis. They came into the world already infected, suffering disabilities that would last their entire lives. Deafness, blindness, bone deformities, neurological problems. Some died within days. Others lived for years, struggling with conditions their parents couldn't explain. The government knew this would happen. They documented it. They studied the wives and children too. They published papers about congenital syphilis transmission rates. They tracked the spread through families like it was a research project, not a tragedy they'd caused. But they never warned the families. They never offered treatment. They just watched and took notes. Now, if you're watching this and you're as shocked and outraged as I am about what happened to these heroes, please hit that subscribe button right now. We uncover stories like this, the ones they tried to bury, the truths they never wanted you to know. Every week, we bring you the untold history that changes everything you thought you knew about World War II. Don't let these stories disappear. Again, subscribe and turn on notifications so you never miss the truth. By the 1960s, the civil rights movement was in full swing. America was finally beginning to confront its racist past. Birmingham, Selma, the March on Washington. Martin Luther King Jr. was demanding justice. Malcolm X was demanding truth. The nation was being forced to look at itself in the mirror. But the Tuskegee study continued. The men were still being denied treatment. They were still being lied to. They were still dying. And nobody outside the Public Health Service knew. In 1966, Peter Buxton, a young venereal disease investigator with the Public Health Service in San Francisco, learned about the study during a training session. Another investigator mentioned it casually, like it was common knowledge. "Oh yeah, we've been running that study in Alabama for decades, watching what happens when you don't treat syphilis." Buxton was horrified. He couldn't believe what he was hearing. He filed an official protest with his superiors, demanding the study be stopped immediately. He argued it was unethical, immoral, and probably illegal. These men were being harmed. They needed treatment. His superiors' response? They refused. They argued the study was too valuable to end, that the scientific data outweighed the harm to the subjects, that these men were going to die anyway, so why not learn something from their deaths? They told Buxton to mind his own business and get back to work, but Buxton couldn't let it go. For 2 years, he gathered evidence. He documented everything he could find about the study. And in 1968, he tried again. He wrote a detailed report outlining the ethical violations. He presented it to the highest levels of the Public Health Service. Again, he was ignored. Worse, he was warned. His supervisors told him if he kept pushing this, it would destroy his career. That he was being naive. That he didn't understand the bigger picture. That sometimes sacrifices had to be made for the greater good of medical science. Buxton realized the system would never stop itself. So in 1972, he did something drastic. He went to the press. He contacted Edith Lederer, a reporter with the Associated Press, and gave her everything he had. On July 25, 1972, the Washington Star ran a front-page story. Syphilis victims in U.S. study went untreated for 40 years. The Associated Press picked it up. Within days, it was national news. The nation was shocked, outraged. How could this happen in America? How could the government do this to its own citizens? Senator Edward Kennedy called emergency congressional hearings. The media descended on Tuskegee. Survivors were interviewed for the first time, many of them learning for the first time what had really been done to them. One man, Charlie Pollard, 66 years old and suffering from advanced syphilis, told reporters, "They never told us nothing. They just kept taking blood and giving us pills that didn't do nothing." The Public Health Service scrambled to defend itself. They claimed the study had been valuable, that it had produced important medical data, that the men had given informed consent, which was a lie. They claimed treatment wouldn't have helped most of them anyway, which was also a lie. Under intense pressure, the government finally shut down the study in November 1972, 40 years after it began. The surviving participants were finally offered treatment, but for most of them, it was too late. The damage was irreversible, but even then, the full truth about the airmen wasn't revealed. The The press focused on the original sharecroppers, the heroes of Tuskegee, the pilots who'd proven black men could fly, who'd fought for freedom. Their connection to this atrocity remained buried. The government didn't want to admit that they'd experimented on decorated war veterans. That would be too damaging, too shameful. It wasn't until decades later, when researchers began cross-referencing military records with public health service documents, that the full scope became clear. Historians like Susan Reverby and James Jones started piecing together the connections. They found the coded medical files. They found the correspondence between public health service doctors and military physicians. They found the research papers that referenced military subjects. Some of America's most decorated pilots had been treated as lab rats. Their service, their sacrifice, their heroism, none of it mattered to the doctors who saw them as nothing more than test subjects. In 1973, the National Association for the Advancement of Colored People filed a class action lawsuit on behalf of the Tuskegee study participants and their families. The case was settled out of court in 1974. The government agreed to pay $10 million in damages. Each living participant received $37,500. The families of deceased participants received $15,000. $37,000 for a lifetime of suffering. $15,000 for a life stolen. That's what the U.S. government decided these men were worth. But the lawsuit focused only on the original sharecroppers. The airmen, because their involvement remained classified, received nothing. Their families didn't even know they'd been part of it. The government kept that secret for another 2 decades. In 1997, President Bill Clinton issued a formal apology on behalf of the United States government. In a ceremony at the White House, with 5 elderly survivors in attendance, Clinton said, "The United States government did something that was wrong, deeply, profoundly, morally wrong. It was an outrage to our commitment to integrity and equality for all our citizens. To the survivors, to the wives and family members, the children and the grandchildren, I say what you know. No power on earth can give you back the lives lost, the pain suffered, the years of internal torment and anguish. What was done cannot be undone. But we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful. And I am sorry." It was a powerful moment. But by then, most of the victims were dead. They died without knowing why they suffered, without receiving justice, without hearing their country say, "We're sorry." And still the airmen weren't mentioned. The full story remained hidden. Herman Shaw, one of the 5 survivors at Clinton's apology, said afterward, "It's too late for an apology. Most of us are dead. And the ones who are alive, we're broken. An apology don't give me back my health. Don't give me back my life." He died 2 months later. He was 94 years old. The last original Tuskegee study participant died in 2004. His name was Ernest Hendon. He was 96 years old. He'd lived with syphilis for 72 years because the government decided his life was less important than their research. In his final interview, given just months before his death, he said, "I still don't understand why they did it. We trusted them. We thought they were helping us. I'll die not understanding." Today, the Tuskegee Airmen are celebrated as heroes. And they should be. There are museums dedicated to their legacy. The National Museum of the Tuskegee Airmen in Detroit, the Tuskegee Airmen National Historic Site in Alabama. There are monuments, memorials, documentaries, and Hollywood movies about their courage and achievement. In 2007, President George W. Bush awarded the Congressional Gold Medal collectively to the Tuskegee Airmen. In 2012, surviving airmen attended the premiere of Red Tails, a feature film about their exploits. And they deserve every bit of that recognition. What they accomplished was extraordinary. They didn't just prove black men could fly. They proved they could fly better than anyone expected. They changed military policy. They helped pave the way for the desegregation of the armed forces in 1948. They inspired generations. But the full story, the dark underbelly of what some of them endured, is still rarely told. Most documentaries don't mention it. Most history books skip over it. The monuments don't reference it. Because acknowledging it means acknowledging something uncomfortable. Something that doesn't fit the heroic narrative. It means acknowledging that while America was fighting fascism abroad, conducting its own experiments on black bodies at home, that the same government that asked these men to die for freedom was simultaneously denying them the most basic human dignity. That racism wasn't just a Southern problem or a social issue. It was institutional. It was medical. It was lethal. The Tuskegee study wasn't an anomaly. It was part of a pattern. In 1946, the U.S. government deliberately infected Guatemalan prisoners and psychiatric patients with syphilis to study the disease, an experiment that wasn't revealed until 2010. In the 1950s and 60s, the CIA conducted MKUltra experiments, dosing American citizens with LSD without their knowledge. In the 1960s, the U.S. Army tested biological weapons on predominantly black neighborhoods in St. Louis. The government has a long history of using vulnerable populations as test subjects, and Tuskegee was one of the worst examples. It lasted longer than any other unethical medical study in U.S. history. It harmed more people. And it was conducted in plain sight, with hundreds of doctors, nurses, and officials participating, and not one of them stopping it. Think about that. For 40 years, medical professionals looked these men in the eye, took their blood, documented their suffering, and went home to their families without losing sleep. They published research papers. They presented at conferences. They advanced their careers on the backs of dying men. And they felt justified in doing it because those men were black. The legacy of Tuskegee isn't just about the airmen who flew or the sharecroppers who suffered. It's about the wives who were infected, the children who were born sick, the families who never knew the truth until it was too late. It's about institutional racism so deep that it infected American medicine itself. And it's about trust. The Tuskegee study destroyed trust between the black community and the medical establishment, a breach that still hasn't healed. Even today, black Americans are less likely to participate in medical research, less likely to trust doctors, more likely to delay seeking treatment. Studies have shown that knowledge of Tuskegee significantly impacts health decisions in black communities. During the COVID-19 pandemic, vaccine hesitancy was higher among black Americans than any other group. When asked why, many referenced Tuskegee. They said, "The government lied before. They used us as guinea pigs before. How do we know they're not doing it again?" That's the legacy. That's the damage. 40 years of lies created generations of mistrust. So what can we learn from this? What's the point of digging up these painful truths? The point is this: we cannot move forward without acknowledging the past. We cannot demand trust without earning it. And we cannot earn it by hiding the truth or pretending these atrocities didn't happen. The Tuskegee Airmen deserve to be celebrated, but they also deserve to be remembered fully, not just as heroes, though they were heroes, but as men who were betrayed by the country they served, as human beings who were treated as less than human by people who took an oath to do no harm. Every time we tell their story, we should tell all of it. The glory and the shame, the triumphs and the betrayals, because that's the truth. And the truth, no matter how painful, is what we owe them. So the next time someone tells you to trust the government, to believe that our institutions would never harm innocent people, remember Tuskegee. Remember the airmen who flew into enemy fire, never knowing the real enemy was waiting for them back home. Remember the doctors who watched them die and called it science? Remember the officials who knew what was happening and let it continue for 4 decades. Remember that freedom isn't free, but sometimes the price is paid by those who deserved it least. This was the brutal experiment on black airmen they covered up. This was the truth they never wanted you to know. And this is why we must never, ever forget. If stories like this matter to you, if you believe these truths need to be told, then do something about it. Subscribe to this channel. Share this video. Make sure this story reaches people who've never heard it. Because the only way we prevent history from repeating itself is by refusing to let it be forgotten. Hit that subscribe button now. Turn on notifications. And join us as we continue to uncover the stories they tried to bury. This is the truth. This is history. And this is what they never wanted you to know.